Therese Ahlers was the she was the founder of WI-AIMH in Wisconsin. And we're just really blessed and lucky that she also happens to live within the southern region and is part of our current chapter and brings all of that experience with her, as well as her current position at 0 to 3. So I'm just going to stop talking and give Therese an extra 5 minutes to share about endorsement.
So hello everyone. It's really nice to be here. And, as Cindy said, I started Wisconsin Alliance for Infant Mental Health, and as I was listening to the video, which I really liked, by the way, I was thinking it was 17 years ago this week that meeting began, so it's a little anniversary of sorts. I now work for 0 to 3. 0 to 3 is a national nonprofit focused on supporting the healthy development of infants and young children. And what I do is I work in the infant mental health policy area, and I provide technical assistance to states and communities around the country about how to make policies that best support infants and young children and their social and emotional well-being. So it's great to be here. And I'm not very technology savvy. I'll just true confessions, but I'll figure this out. Yeah. Oh, right here. Look at that. Look at. What we're going to talk about today. So I'm going to start a bit about what the endorsement is. I'm going to give a little bit about the history of the competency and endorsement system, and I'm going to, say a little bit about the history because I don't want people to think that, this system was set up by, a bunch of thinkers sitting around a table for a year and coming up with this competency and endorsement system. It wasn't done. It was a long evolutionary process. And just to let you all know, I also am endorsed. I'm endorsed at Category 4 policy, and we'll get into what these divisions mean in a little bit. So I always like to think about, you think about why are we talking about infant mental health competencies, and what the stance that I often take is that infant mental health or social emotional development is the foundation of all future development. Social emotional development is the foundation for physical development, cognitive development, language development. It's kind of like the foundation of a house. You need to have a good foundation, and that foundation is social emotional well-being. So, and this comes from a paper that I really like that 0 to 3 put out a number of years ago called Making It Happen. So that's why we're talking about social emotional development, and we're not talking about physical development or cognitive development. We're talking about social emotional, and we're talking about those competencies regarding social emotional development. So given what the research tells us, what we need to think about is that everyone who touches the life of a child, everyone needs to know how to support that social and emotional well-being. So if you think about it for a moment, a kiddo without any challenges, obvious challenges, that circle of support, those caregivers that surround that child, are parents, potentially parents, child care providers, maybe a home visitor, but usually a pediatrician or a family practice doctor. And so we need to think about what do they know about supporting social emotional development. But then if that kiddo has some challenges and some problems, that circle of support becomes so much larger. So that circle of support could include early intervention, could include child welfare, home visiting, specialized medical professionals. And so we need to think about what do they know about supporting social emotional development. And then I also, as a policy person, as a policy wonk, you have to also think about, what about the people that are making, these rules and regulations, these policy people? What do they know about, supporting social and emotional development? So all of these caregivers need to know what is best in terms of supporting social and emotional development. So again, everyone who touches the life of a child needs to be competent. And when I say that, I'm not asking for everybody to be a mental health clinician. We don't need all those mental health clinicians. Not every child sees a social worker or a psychiatrist. And we don't want every child to see a social worker or a psychiatrist. But we want whoever that child is seeing in their day-to-day life to know how to support their healthy development. So, gotta catch up here. I'm getting ahead of myself. So, competencies. If you think about it, there's no such thing as a baby. There's a baby in someone. A baby cannot survive on its own. A baby survives based upon, the caregivers that I just talked about. And what the competencies do is ensure that that the person knows how to support that well-being, that healthy development. So some people were saying that they are endorsed at level such and such. It used to be called levels, and they're now called categories. And the reason why they're called categories is because it's not a hierarchy. People, everybody wanted to be, I want to be a 4. But it's really not about, it's not really a hierarchy, it's not about levels, it's more about your career pathway. It's more about, what you do to support infants and young children. So if we talk about category 1, that's an infant family associate. An infant family associate, generally speaking, does promotion activities or prevention activities. So, and there's a lot of gray here. There's no black and white. So that's a really important thing to think about. But typically, a category 1, an infant family associate, would be like a child care provider, a doula, a midwife, a parent, maybe even some of those other people that we may not think about, a bus driver, a cafeteria worker, people that interact with kids, and where sometimes kiddos can, get into trouble, those transition areas. Category 2 would be infant family specialists, and typically those people would be early intervention people. Other people that would be category 2 could also be, a home visitor. So and each category is built on the last category. So a category 2 person, an infant family specialist, would typically do, promotion, prevention, and early intervention. And again, these people are not infant mental health clinicians, but what it means is that you're looking at your work, you're looking at that child through the lens, with an infant mental health lens. Category 3 is an infant mental health specialist. And this is clinical intervention. And in this category, it means that you have a license to practice. So oftentimes we think about a mental health license to practice would be like a social worker. But these folks could also include a physical therapist, a speech therapist. We could think about nurses, a nurse practitioner, a psychologist, psychiatrist, people that have a license to practice. And again, a clinical license to practice, looking at the child through the lens of infant mental health. And finally, there's an infant, the 4th category is infant mental health mentor. And just to make it more confusing for you all, there's 3 categories of mentor. One category is research or academia. Another category is clinical. And then the 3rd category is policy. So I'm going to pause right now and see if there's any questions and if that's clear. Okay, excellent. So what does it mean to be endorsed? What it basically means to be endorsed, it recognizes that specialized knowledge, skill, and experience that people have. In order to be a nurse, you don't take like a weekend course, in broken arms. Just like, you know, to be endorsed, it's not like a weekend course on play therapy. It doesn't make you an infant mental health clinician. And as Cindy said, you know, I started Wisconsin Alliance for Infant Mental Health, and Wisconsin has had the infant mental health endorsement since 2009. And to be quite honest with you, I was really opposed to getting the competency and endorsement system, and I thought, oh, we can do it ourselves. And you know, started meeting with people, early childhood people, kind of trying to figure out competencies. What do you really know to support? But then I met Debbie Weatherston, who is kind of the grandmother of the competency and endorsement system out of Michigan. And they had it all there. And it really made a lot of sense to me that they had these categories, that people, you know, not everybody was a clinician, that, you know, you needed to look at kids through a mental health lens, and that if mental health, and it is the foundation of healthy development, then that's the way we needed to go. And this is all in the context of relationships. So what it means to be endorsed is that you have that specialized knowledge, skills, and experience in order to see children through the infant mental health lens. So the Michigan Association for Infant Mental Health, that's where these came from. And in Michigan, it's a very long name, I'm going to read it. The Michigan Association for Infant Mental Health Endorsement for Culturally Sensitive, Relationship-Focused Practice Promoting Infant Mental Health. So these competencies, you know, why do we want competencies? I think there's a number of reasons to have competencies. One, it's a systematic way for workforce development. And what I was finding, you know, in these early years when I started WI-AIMH is that, you know, I would talk about infant mental health and people say, infant mental health, what's that? You know, people didn't know what it was. And, you know, true confessions, when I was approached to ask to start Wisconsin Alliance for Infant Mental Health, I had never heard the term infant mental health. And I was working for state government in mental health. And prior to working for state government, I was a clinician working with adults with mental health issues. So, you know, there wasn't a lot of knowledge about what infant mental health was in Wisconsin. But anyway, in Michigan, there's a woman by the name of Selma Freiberg. Some of you may have heard of her. She's kind of like the grandmother of infant mental health in my eyes. And Selma Freiberg, she coined the term infant mental health, even though she hated the term infant mental health, but she got a chunk of money from the mental health division within Michigan. And Michigan said, we'll give you this money if you call it infant mental health. And so hence the term infant mental health was born. But what Selma Freiberg did is she worked in homes. And she worked in homes with families, with babies that were struggling. You know, that's how basically this whole field was born. And these competencies are specific to supporting a child's well-being. They're culturally sensitive, and again, they're relationship-based. So at this point in time, there's 29 states that have adopted the Michigan Competency and Endorsement System. And not only 29 states have adopted them, but the country of Ireland has, and the western part of Australia has. So it's now becoming this international thing. Some of you may have heard of the League of States. When all these different states started approaching Michigan saying, can we purchase this? These states started organizing, and they were called the League of States. And when I was with WI-AIMH, I was very involved in the League of States. And I encouraged the League of States. I said, I don't think we can continue like, you know, have Michigan Association for Infant Mental Health and the League of States all under Michigan. What if we break off? So now it's called the Alliance for the Advancement of Infant Mental Health. And everybody that has the license to use the competency and endorsement is part of this alliance. And this is one of the great aspects. We have this wonderful national kind of learning collaborative, so to speak. So WI-AIMH, you know, if they're struggling with something like, you know, how do we integrate reflective supervision, you know, into child welfare? there's a communication method. You can, type on Basecamp, how do you do this? And lots of different people can respond. Also within the Alliance, there's regular meetings. So there's a policy meeting, and actually, even though I'm not affiliated with the state any longer, I participate with the Alliance on the policy phone call. But there's also a training phone call, there's a leadership phone call, and there's probably others that I'm forgetting. Do you know if there's any others, Jenny? You're probably not quite there yet. That's okay. That's okay. So it's a wonderful learning opportunity. And you might as well learn from other states. So here's a picture of all the different states that have, the green states are the ones that have the competency and endorsement system. You'll see the states in like the bluish purple. Those are states that are like kind of considering purchasing the competency and endorsement. And as I said earlier, at one point in time, I wasn't supportive of it. I kept thinking, wow, it's so expensive, and what do you get? But now I'm a true believer. And in my previous role with 0 to 3, I talked to lots of different states about the competency and endorsement system. And Michigan kind of dubbed me the ambassador of the competency and endorsement system. So like I was influential in West Virginia and Iowa and Washington and Oregon and Pennsylvania, and them getting the competency and endorsement system. And I tell them, that I'm biased, so they know it, but, so they know up front that where I stand. But I don't want to give the wrong impression that the states in gray, some of them have decided to create their own competencies. So some of those states have their own competencies, and those states include California, Illinois, North Carolina, New Hampshire, and Vermont. And so all of them have the competencies. Another thing that I think Michigan did rather well is one of the requirements is that the Infant Mental Health Association is the required purchaser. The Infant Mental Health Association is the person that needs to own the license. And that makes a lot of sense, and the reason why it makes sense is that if a state agency like the Developmental Disability or Home Visiting or Child Welfare owned the license, it would become, over time, home visiting-ish, or more child welfare-ish. So they recognize that infant mental health is a multidisciplinary system, a multidisciplinary field, and they wanted to make sure that multidisciplinary aspects stayed with it. One of the first things that I did as shortly after we started is I helped support the development of an infant mental health plan in Wisconsin. And something that I used to help guide me was Florida. Florida had a really nice infant and early childhood mental health plan. But if you went through that Florida plan, you could see that it was very skewed toward developmental disabilities. And then I came to find out that it was developmental disabilities money that supported the development of that plan. So I think it's important to keep in mind that cross-disciplinary aspect. So here comes the evolution. So it started in the 70s, like I said, with the work of Selma Freiberg. So if you think about it, back in the 70s, there was still this debate about, nurture versus nature. And some people still believe that kids were a blank slate. But Selma Freiberg did it, she was a woman kind of beyond her time. So she developed services in the home. She coined the term infant mental health. And in 1983, this is pretty phenomenal too, is Michigan Department of Mental Health funded infant mental health services and funded infant mental health services in the home. And this is something that a lot of states now are struggling. How do we pay for infant mental health services? And oftentimes, infant mental health services, people struggle to pay for them, in part because the mental health system was based initially on adults, and then kids came later. Through this history. So in the 80s and 90s, a few things happened. One, 0 to 3 put out this paper called the task document. The task documents detailed specific knowledge and skills that anybody working with infants and young children was supposed to have. But at about the same time, IDEA came out, and it encouraged family perspective when working with infants and young children. In 2002, Michigan came out with the competencies, and they said that it was to promote a child's well-being, that they needed to be culturally sensitive, and that they were relationship-based. But what they did basically was they combined a number of different papers and thinkings at the time, one being the task documents from 0 to 3 and the information from IDEA. So what do the competencies look like? There's 8 domains of knowledge, and I won't read them for you, but when you go for endorsement, what is mostly emphasized is the theoretical foundations and the direct service skills. So why have competency guidelines? I kind of covered this already. You know, it gives kind of a guideline for what training should look like. It supports consistency in practice. You know what people know if they're endorsed. It can be used as criteria for reimbursement, and it can be also used for criteria for hiring. So why get endorsed? You know, endorsement, you know, tells the world basically that you have this, you know, set of knowledge and experience, that you know what that you've been acknowledged or recognized as having, you know, certain knowledge. It also validates the work you do, and it affirms that specialized knowledge. So the endorsement process, I won't say a lot about this either, and up on this table there's a number of different papers, and this is a nice paper. On the back side of it is all the criteria that you need to meet in order to be endorsed. I think that's really, really helpful. But basically, you submit a portfolio. Portfolio has your work, it has your transcripts, your in-service training hours. You need to assign code of ethics. You need to have professional references, and in some categories, 2, 3, and 4, you need to have supervision hours or consultation hours. And also for categories 3 and 4, you need to take an exam. This is what I want to say. You know, a number of people, when they went around, talked about, I went through the capstone program, and this tends to be a piece of confusion in Wisconsin. You do not have to do the capstone program in order to get endorsed. There's many, many pathways to endorsement. So for instance, I'm endorsed and I never did the capstone program. But if you do the capstone program and you successfully complete it, you automatically qualify with the education requirements. So that's something to keep in mind. So this is a little thing from 0 to 3 that I really, really like. All development occurs within the context of relationships, and to develop a child's mind, what we really need to do is nurture a child's heart.